Hello everyone, welcome back to my channel. I'm Nurse Adorable, and in today's video we'll be talking about how to help a child that is having seizure. We often call it convulsion, but the word I'm going to be using in today's video is seizure. So we're going to be talking about how to help a child that is having seizure, and I will just urge you to please watch this video till the end because you will be learning a lot from this video. I also want to thank all my subscribers for subscribing to my channel. I want to appreciate you all. You are the best, and I am appreciating my intended subscribers too. Thank you for thinking about subscribing to my channel, or thank you for subscribing to my channel right now. I also want to appreciate everyone that has been watching my videos, that has been sharing my videos, that have been sending their likes, and you all. Just as I have said that we'll be talking about seizure today. Emergency care, like our first aid care for a child that is having seizure. And seizure means an electrical activity that occurs in the brain, an electrical activity in the brain that causes change in behavior, movement, and sometimes feelings. So under normal circumstance, the electrical activity in the brain involves the nerve cells, and it helps the brain to send signals to other parts of the body, so at different time. So that is the function of the electrical activity in the brain. It helps to send signal from the brain to the other parts of the body at different times. But when there is seizure, what happens is that it sends the signals at once instead of sending the signals at different times. So it sends the signals at once. There are different types of seizures. I'll mention few in today's video just to save our time. So there are different types of seizure. We have the epileptic seizure, we have the febrile seizure, and in today's video I'll be dwelling more on the febrile seizure. So febrile seizure is the most common type of seizure in children, and this is as a result of fever. Febrile seizure, so it means fever, a seizure that occur as a result of fever. Do you understand? So fever can be due to infection process in that child's system, or low level of sodium in the blood, or if there is any brain injury, if there's any damage to the brain, and tumor in some cases. Tumor, that is abnormal growth in the brain. So those are the causes of seizure in children. Those are the causes of febrile seizures in children. And generally the cause of seizure can be poisoning. It can include the use of drugs and alcohol, electric imbalance, electrolyte imbalance, hypoglycemia. That is when there is a very low of sugar level in the blood, a very low level of sugar, glucose in the blood. Brain injuries, fever, cancer, infection. And at times the cause of seizure may be idiopathic, which means that the cause may not be known, the cause may be unknown. So that is a brief introduction to what we're going to talk about today. And now let's move into how to help a child that is having seizure, like let's say a convulsing child. How to help that child as a parent, teacher, nanny, or as a member of a neighborhood. Do you understand? So now what you're going to do is that you're going to place that child gently on the floor. place the child gently on the floor, a flat surface, and remove every nearby object, every object that you know that can lead to accident, one form of accident or the other. You should remove such items from the environment of the child while you're laying the child on a flat surface, on the floor, to be precise, on the floor. Then what you're going to do after that is that you're going to lay the child on his or her side. If the child is having any draining substance, if there's any drainage from the mouth, you're going to turn the child to a side and allow the drainage to come out, so that the child will not aspirate that substance is draining. Do you understand? So it is important that you lay that child by the side, so that even saliva will not be aspirated. And you also, if there is any vomit from the mouth, you use a neat cloth to wipe it off, and you loosen up tight clothing around the child, all tight clothing around the neck, around the head. You remove such clothing, like maybe the child is putting on a cap, a tie, or the shirts, you just make sure you loosen all tight clothing around the neck and the head. Then you make sure your child is breathing. When a child is passing through seizure, you observe if that child is still breathing. It is very important, because if the child is not breathing, that means that is no more seizure. It is no more a seizure. It is now maybe the child is passing out. Do you understand? So you need to check if your child, make sure that your child is breathing. And if the seizure is caused by fever, what you're going to do is to do something that will bring down the fever as soon as possible. What's going to bring down the temperature as soon as possible. In my last video, I talked about how to help a child that is running fever, how to bring down the body temperature of a child that is running fever at home or anywhere aside, like the first aid care you give a child that is running fever before taking that child to the hospital. So if you have not seen that video, kindly watch that video. The link to the video is the one popping up on the screen right now. So if you are yet to see that video, kindly watch that video at the end of this video, because it will help you to know what to do to bring down the temperature of that child if the seizure is as a result of fever. And in one of the things I mentioned in my last video, I talked about giving the child fluid to bring down the body temperature, and also giving the child paracetamol. In this case of seizure, you are going to skip the 2 steps of giving the child, of hydrating the child and giving the child paracetamol. You're going to skip that aspect. You are not going to give anything to your child that is having seizure. You're not going to give that child anything per oral. That means you're not going to give anything to that child through that child's mouth, because it can be aspirated and it can lead to any other complication. So what we're going to do is that you skip the aspect of hydrating the child, and you skip the aspect of giving the child paracetamol, but you do all other steps that I have mentioned, that I have described. I did a kind of practical in that last video. So go watch that video and know how to bring down the temperature of your child if the convulsion, if the seizure is as a result of a high body temperature. Also, the link to that video, you will also find it at my description box for this video, my description box. So you're going to see the link to watch that video there. And another thing you're going to do is that you do not put anything inside your child's mouth. Don't put anything into their mouth during that during the period of their seizure, and because it can lead to injury and or even block the airways. So you don't insert anything into their mouth, just leave them, lie them down on the floor, wipe away all drainage, turn their head to one side to enable the content in their mouth to drain. And do not try to prevent your child from shaking. You just make them comfortable while they're lying flat on the floor, so you don't make your child, you don't try to, maybe they are shaking, and you don't try to stop them from shaking. You don't try, so that you will not injure them. Try to note how long the seizure lasts. Does the seizure last for 5 minutes? Does it last for 10 minutes? Because when you get to hospital, you're going to give your health caregiver the history, so make sure you know how last the seizure went, and you stay with your child till the end of the seizure. Make sure you stay with your child, make your child comfortable, and at times most of them they sleep off immediately after the seizure. They sleep off, so allow them to have that rest. And most children who have seizure in their childhood, when they grow up, they do not have it again. So they grow up not having seizures again. But it is important that you know the cause of your child's seizure. It is important that you know the cause of your child's seizure, because this will help you. It will go a long way. It will go a long way in helping your child to gain back his or her health. Do you understand? So now let's talk about how to prevent the reoccurrence of a febrile seizure. Remember that in this particular video we are making today, or that in this particular health talk I'm giving you today, we are focusing on febrile seizures. So let's talk about how to prevent the reoccurrence of febrile seizure. So once you are aware that your child's seizure is caused by fever, you need to know the cause of the fever. And you need to prevent the cause of the fever. So now, if the seizure is caused by fever, maybe at that time that your child is having that seizure, you observe that the temperature is on a very high side. So that's an indication for you that the seizure is caused by fever. So what you're going to do is that you bring down the temperature. You make sure that your child do not run temperature to the extent of having seizure. You prevent your child from having fever. That is what I'm trying to say. You prevent your child from having fever. If you prevent your child from having fever, the child will not have seizure. Do you understand? Then what you need to do is that, and once you observe that your child is already running temperature, you try as much as possible to bring down that temperature as quick as possible. Then let me mention few conditions that can lead to fever. That can lead to fever, like malaria can lead to fever, can cause a very high body temperature, and infection, maybe gastroenteritis, all sorts of infection in the blood, urinary system infection, urinary tract infection, those things can lead to fever. So to prevent, let's dwell more on malaria. To prevent your child from having fever as a result of malaria, you need to prevent the occurrence of malaria. If you live in a malaria endemic if you live in a malaria endemic place, that means a place where there are lots of mosquitoes, and the most common illness in that area, if the most common illness in that area is malaria, what you do is that you make sure your child sleep under a treated mosquito net. You prevent the breed of mosquitoes as possible as you can. You give your child a prophylactic anti-malaria to prevent your child from having malaria. Then you make sure your children they put on their long sleeve shirt, and they put on also a long pants, and you observe them time to time. You observe your children time to time. Then to prevent infection, treat your children how to observe and regular hand washing. Not only proper hand washing, proper and regular hand washing. When you bring them up in that habit, they know when to wash their hands. They know that it is important for them to wash their hands, and by doing this they will not put in their contaminated hand into their mouth, and you are controlling a lot of infection by doing that. Let it become their habit, and ensure their personal hygiene. To take them to the hospital for periodic general medical checkup. This is very important. Nigerians, I know we don't do that. It is until our child starts running temperature, start vomiting, that's when we start running from one place to the other. So it is important that we take our children to the hospital for a periodic regular medical checkup, and ensure you prepare your children's meal by yourself. Pack your children's food for them to school. Do you understand? So that when you are doing this, you are preventing food poisoning, you are preventing contamination of food. Do you understand? And it will help your children to live healthy. Your children who suck their finger, so some with two fingers at a time, we have them a lot. So when your child sucks their finger, make sure you stop them as soon as possible. And while you are still trying to control them from not sucking their fingers, you make sure they maintain their hygiene. Make everywhere tidy, make everywhere hygienic. Do you understand? So for your children, okay, I've talked about that. In one of my subsequent video, I'll be talking on other causes of seizure, most importantly epilepsy. So that I'll be talking about that in one of my subsequent videos. So if you like this video, kindly give it a thumb up, and if you're yet to subscribe to my channel, kindly do. And I would love to see your comments at the comments. Thank you for watching this video. Drop your comment at the comment section below, and I'm going to see you, or you're going to see me, in my next video. Live healthy and stay safe. Bye.